Hello, and welcome to the AMBOSS tutorial on hygienic hand disinfection. We've condensed the classic 6 steps of hand disinfection into 3 easy-to-remember steps, beginning with the palms and backs of the hands, followed by the fingers, and ending with the thumbs. The entire process won't take you more than 30 seconds. To start, apply sufficient disinfectant to your dry, cupped hands, using the dispenser 2 to 3 times with your elbow. Don't skimp on the disinfectant here. It's fine if it drips. To disinfect the palms and backs of your hands, rub your palms flat against each other, ideally holding them horizontally so you lose less disinfectant. To disinfect the spaces between your fingers, rub your palms together with your fingers interlaced. Next, rub the back of one hand against the palm of the other with the fingers again intersecting, then switch. Now, let's concentrate on the fingers. First, interlock your closed hands, rubbing the backs of the fingers of each hand into the palm of the other hand. Next, disinfect your fingertips and nails by holding together the fingertips of one hand and rubbing them against the palm of the other in a circular motion. Then switch. By the way, your hands should still be wet at this stage. If they've already dried, just apply some more disinfectant. Finally, don't forget to disinfect the thumbs, an important step that's often forgotten. Grasp the thumb of one hand with the fingers and palm of the other and rub it thoroughly using a circular motion. And that's it! This simple sequence will help you to not forget anything. So, quick recap. Hand disinfection only takes 30 seconds. First, rub the palms and the backs of the hands, including the spaces between the fingers. Second, the fingers, including the fingertips. Third, the thumbs. Okay, your hands are now disinfected and you're ready for clinical tasks. For more details, including when hand disinfection is especially important, take a look at our related AMBOSS articles. Or, if you're keen to get into the OR, you can move straight on to learning how to perform a surgical scrub.